Welcome back to the week 4 of this course on ACL injury rehabilitation. Intermediate phase. Lecture 17. Weight bearing progression and hydrotherapy in mid-rehabilitation. Optimal loading to promote healing. I am Dr. Jerrin Shaji from the Department of Sports Medicine, AFMC, Pune. In this lecture, we will be elaborating on the importance of progressive weight bearing and the role of hydrotherapy to support knee function during the mid-rehabilitation process. The learning objectives of this lecture are to understand the phases of weight bearing progression, to know the benefits of hydrotherapy, various clinical protocols and examples, precautions and contraindications for hydrotherapy, the use of technology in monitoring gait reloading. So let's review the phases of weight bearing progression. Partial weight bearing has to begin in early weeks of post ACLR and advance to full weight bearing as tolerated, aiming for improved range of motion and muscle control. The initial phases, 0 to 2 weeks, usually start with toe touches or partial weight bearing using crutches. The goal here is to protect the graft, reduce swelling, and to initiate gentle movement. During the intermediate phase, weeks 3 to 6, we progress to weight bearing as tolerated. The assistive devices are removed once quadriceps control and gait mechanics are adequate. The criteria for progression includes range of motion of flexion of the knee greater than or equal to 100 degrees and quadriceps strength more than 60% of the uninvolved side. For full weight bearing, we wait till almost 6 weeks. The range of motion knee brace may be unlocked if quadriceps control is sufficient. Patients should have normalized walking gait and supported stair climbing. Aggressive strengthening and balance exercises advance further after this stage. Now let's see what is aquatic therapy and hydrotherapy. Aquatic therapy is a clinical goal-oriented use of water-based exercises and is performed in a therapeutic pool, usually under the supervision of a trained therapist to improve strength, mobility, balance, to reduce pain and improve function. Whereas hydrotherapy is a broader therapeutic use of water in any form, such as hot fomentation, cold immersion, steam application, ice application, whirlpool, contrast bath, etc., to relieve pain, to improve circulation, or to promote relaxation and healing. In short, aquatic therapy is exercise or rehabilitation in water, whereas hydrotherapy is the therapeutic use of water in various forms. Now let's see the various benefits of hydrotherapy. Hydrotherapy exploits the unique physical properties of water to facilitate neuromuscular recovery during ACL rehabilitation. The various physical properties of water are useful for this purpose, such as buoyancy, which reduces joint loading, allows earlier pain-free movement to restore gait and range of motion, and provides confidence for balance retraining. Resistance and viscosity. The water's multi-directional resistance challenges stabilizing muscles, whereas proprioceptive and neuromuscular re-education are promoted by the unstable aquatic environment and resistance during gait retraining and balance drills. Hydrostatic pressure. The hydrostatic pressure of the water decreases swelling, improves circulation, and helps reduce muscle inhibition after injury. Temperature and turbulence. The warm water facilitates muscle relaxation and motor control. It improves flexibility, whereas the turbulence increases motor control and adaptability. Coming to various clinical protocols and examples, progressive exercise and hydrotherapy protocols target specific clinical goals, usually starting from week 4 and beyond. The various weight-bearing exercises are wall sits with progressive knee flexion and hip flexion, calf raises, double leg mini squats and step downs, also advancing as tolerated with medical oversight. This is an example for a hydrotherapy exercise progression as shown in the screen. From week 4 to 6, supported walking and single leg balance in water can be practiced, whereas beyond that, shallow water jogging, lateral movements, and various core stability drills can be started. Integrating both individual and group sessions, the feedback shows faster normalization of gait and range of motion with combined land and pool therapy exercises. Let's see some contraindications for hydrotherapy. As for any therapy, safety is paramount in hydrotherapy too, especially while reloading protocols. The individuals must be of utmost care when entering or coming out of the pool. Whereas few contraindications for hydrotherapy are open wounds, active infections, certain skin conditions like allergy to chlorine, incontinence to urine or feces, severe epileptic episodes, recent surgery when the wound is not healed, fever, and various cardiovascular issues. Coming to the various precautions while performing hydrotherapy, before you plunge into the pool, always screen for certain precautions. So coming to the general precautions, always screen the individual for aquaphobia, monitor for overexertion while performing hydrotherapy, ensure adequate monitoring and supervision by trained individuals, adapt various protocols to individual as per their healing rates. Also, few weight-bearing precautions has to be taken care of. Avoid rapid progression in weight bearing. If quadriceps control, gait symmetry, and range of motion milestones are not yet met, then keep slow in weight bearing progression. Also beware if there is persistent effusion or pain which is increased during or following the hydrotherapy protocol. Now coming to technology in monitoring gait reloading. Modern rehabilitation uses advanced technology for gait and loading feedback to individualize protocols for better rehabilitation. Wearable sensors such as accelerometers, pressure insoles, and inertial measurement unit based systems help in detecting gait asymmetry and to monitor load progression. It also provides a kinetic and kinematic feedback. Kinetic feedback is in terms of the joint forces, and kinematics is in terms of joint movements. The use of artificial intelligence tools such as real-time analysis allows screening for risk markers and tracks between limb differences. It also facilitates outside clinic monitoring for continuous feedback and safety of the patient. In this age, data is like gold. So various data outcomes help in customizing a better rehabilitation plan, such as step count, limb loading, stride length, and symmetry metrics are used to titrate progression from assisted to unassisted gait. These are my references. Thank you very much. Have a nice day. Jai Hind.